Autistic spectrum disorder. It's quite common, 1 in 60 children. More common in the boys, 4 is to 1, and your one sibling affected, subsequent sibling may be more 10% more recurrence. The disrupted neural connection, your processing information defective, the Down syndrome and other few symptoms, Smith, Zovert, they have more amount of the SD, a maternal obesity, and your short is birth spacing, prematurity, torch infection, and metabolic syndrome, mitochondrial dysfunction, and most of the time we do not know the cause. These are the wide variety of etiologies. These children have language barriers. When a child cannot utter 10 words by 2 minutes, 10 2 hour 2 years, regression or loss of speech, echolalia, repeated speech, less use of language, delayed response when someone is being called, absent or delayed social smile, poor facial response, negative effect, the negativism, and when decrease awareness of people around the him or her, and your introverted type, socially withdrawn, less social interaction, and stay alone, enjoy walking or playing with one, poor eye contact, poor social orientation, and poor joint attention, imagination, repetitive behavior. They are very less, cannot think. So other focused and unusual activities, and your excess or underreaction, inappropriate reaction. So they are the features of the ASD, autistic spectrum disorder, and these children frequently have intellectual disability quite high, 50%. ADHD is another one third, and tics, motor abnormalities, epilepsy, your sleep disorder, anxiety, depression, OCD, obsessive compulsive disorders, and psychotic behavior, substance abuse, even they are more common now. Oppositional defiant behavior and personality disorder, psychotic behavior, all are possible. And aggression, self-injury, and pica is present in one third of the cases. Suicidal attempt is possible in 1/10 of the cases. So, and then it's quite severe sort of disease, and little bit of genetics is involved there. Yes, and fragile X DNA, and that should be checked, and then little left can be checked. ECG, EEG, and the brain can be investigated, but good amount of time investigation may reveal nothing. So how to deal this treatment? They should have language therapy, social therapy, occupational therapy, and physical therapy. So accompanying symptoms like convulsion should have anticonvulsant. Your sleep disorders can have melatonin, depression, the your antidepressants, SSRI, and stimulant like atomoxetine in ADHD, and your at times risperidone, and your and its other generation of your antipsychotic medications. They are useful. A lifelong treatment and difficult journey, so refer to a special center and a specialist best for this disease.